Hey guys, this is Louis from ndxtesting.com, and in today's video, we're going to speak about EMG studies. Now, if you're a patient and you're seeing this video for the first time, well, the first thing you need to know is what is an EMG? Well, an EMG is a nerve and muscle examination. And those are the two key words that you need to remember. Now, the nerve examination is done by using electrical impulses on the extremities, meaning arms and legs. Now, the muscle examination, the physician performing the study, either a neurologist or a physiatrist, they do not use electrical impulses. They use an electrode. It pinches a muscle and records the muscle activity. Two different procedures. One is predominantly done by the technologist, which is the nerve study, and the other one by the physician, which it's either top two guys, either a physiatrist or a neurologist, and then we put everything together. Either way, with that type of test, we get a complete diagnostic view of the body. Like for instance, if you're going to have the upper study, then we get a complete diagnostic view from the neck all the way to your the fingertips. Now, one of the things that you need to know just for your personal education when it comes to nerve examinations and EMGs is that all the nerves you have from your shoulders to your fingertips originates from the neck. So the neck is like the fuse box of the upper extremities. So when the technician does the nerve studies, they actually are studying connective nerve roots that are originating from the neck. So when I start a nerve examination, always, let's just say I started at the wrist, that nerve that I'm testing is connected to the neck. If that nerve that's connected to the neck gets disconnected, then there will be, it will not work. Will be no function, will be no response. Now, one of the questions that is often asked, now, do these tests hurt? Every time I get a patient, do they hurt? Now, the truth of the matter is, and I'll be completely honest with you, okay? After performing these studies for 25 plus more years, I started in 1994, okay, or 1993. So it's been a long time that I've been performing these studies. Now, nerve examinations do not hurt. At worst, they could be a little bit uncomfortable. Now, if you know how to use the pulse width, and you know how to use the intensity of the machine, remember, we use electrical impulses to do the nerve study. So if you use too much intensity, it's going to be extremely painful. Now, the correct way to do it is when you start a test, no matter who it is, it could be a young 24-year-old girl, 120 pounds, completely healthy. It could be maybe someone older, okay, 60, 70 years old, 300 pounds. It doesn't matter who it is. It could be a male. I just had a patient the other day. The patient was 250 pounds, 6 feet, 6'6" actually, as tall as Michael Jordan. And the objective is to use the exact amount of intensity that that patient needs for the nerves to react, okay? Often what happens is that doctors and technologists, they're trained a little bit differently, and they do train them to use high impulses. They are trained to use the intensity high. So when you go for the exam, the correct way to do it when you have that nerve study performed is you start the intensity at 0. You increase until the patient feels it. And then you're going to tell the patient that all you're going to do is use the exact amount of intensity that that particular nerve needs for the nerve to react. Now, for instance, when you stimulate at the wrist, you're going to get a motor reflex, a thumb motor reflex. You come up at the arm, you're going to get a bigger reflex. So if you know how to play with the pulse width, with an intensity, it's going to be a slam dunk. So what we're going to do, and for the first time ever, I'm going to take you behind the scenes so you can see for yourself. I'm going to do it to myself. You're going to see how I react. And you're going to see when I increase that intensity on myself, it's going to be painful. But if I use the exact amount, whatever I need, whatever my body structure needs, then it's going to be fine. And that's usually what I do. And listen, I'm not going to lie that it's a walk in the park. Remember, we do not do ultrasound. In ultrasound, what happens? You have the computer, okay, or the machine they call it, and they have the probe. You put a little gel, it goes on the skin. I've had this test before. In fact, my cousin, he's an ultrasound tech. He specializes in the cardiovascular system. I just had a complete a bunch of tests. I had echoes, I had vascular studies, I had all kinds of stuff. It's that gel. It gets cold and your body just quivers. But other than that, it's nothing. You just lie there and nothing's going to happen. But when it comes to EMGs and nerve examinations, we use electrical impulses and we use a needle electrode to pinch the muscle and record the activity. So we have to be really good at communicating the exam, really good at doing the exam, and really good at making the patient feel comfortable. And that's what it's all about. And there are some patients who are electrically sensitive, but you speak with them, you coach them. So anyway, let's go behind the scenes so you can see for yourself what this test feels like. Okay, I'll see you on the other side. All right, guys. So listen, I have you in front of the screen, so I'm going to give you guys a clear demonstration how the NCV is supposed to be performed. Now, usually I start with a pulse width at 200, but for this demonstration, I'm going to do it. I'm going to start at 100. So I'm going to take the intensity all the way to 0. Now, it's important that when we perform a nerve study, right, we start with the intensity at 0, and we communicate that to the patient. You're not going to feel anything. I want you to relax yourself a little bit. And I'm going to increase the intensity just mild. You're going to feel it, and then all you're going to do past that is you're going to increase the intensity until the nerves depolarize, until the nerves react. So I'm going to give you guys a quick demo so you can see for yourself. Now, what I'm using here, I'm using a Catwell Wave. This is actually a 2008 base unit. But what I did back in, I think January, or between January and April, we got this little base unit certified, so we made everything brand new inside. The stim that I'm using here, it's also certified. Let me see when did this thing get certified. Back in January, and I think the amp here got certified back in March 25th of this year. And then what we did was we bought a brand new Windows 10 Dell laptop. So we made this machine pretty much brand new. There was no reason to buy a new one. Catwell usually has good machines, and ever since I've been doing nerve examination for the last 20 plus years. That's all I've ever used, but there's other machines that are just as good or even better. But anyway, let's get started. I'm already hooked up. I'm going to show you guys my hand here really quick. So I have the intensity at 0. Okay, so now I stimulate, I don't feel anything. So let's increase a little bit. Let's see how I respond here. I got it at 4, 14. Okay, look at that, 14. So I'm going to increase a little bit more to see if it changes. Nope. Okay. 16, nothing. That's basically my supra-maximal response. So let's just say that I respond here at 13, which I do. What you're supposed to do when you do the nerve study, you want to just increase a little bit to see if that's the actual response. Maybe the amplitude, which is the height of the nerve, goes up a little higher. And this time it doesn't. Let's just say I take it up to 18. See, it doesn't change. So if I take it up to 21, it doesn't change. So you don't really have to go that high. You just basically have to know how high you need to go. Now, what dictates how high you're supposed to use the intensity is the patient's body. Now, I'm 5'9", 175 pounds. So someone like me is not going to need much intensity. So that's all it will take. Now, if I go all the way up to 29, let's just say, starts to sting a little bit. 34, starts to sting a little bit. I can't do past. Let me see if I could take it up to 38. I mean, did you see how the response doesn't change? So if I take it back now to 17, 16, 14, 13, now 11, it starts to go a little lower. So then 10 starts to go a little lower. Okay, so then basically the response that I would need with a pulse width at 100, anywhere between 15 and 16. Okay, that's for the actual wrist median nerve, so you can see for yourself. Okay, all right, so let's save this. I'm gonna get a little bit more gel, and let's do the median nerve at the level of the elbow. I'm probably not gonna be able to see it because the record. I thought I was gonna be able to record a little bit better, but this is the best I can do here. Anyway, so let's go. I'm gonna leave it up to now. Now the intensity is at 15. So when I go up to the arm, right? When you stimulate at the wrist, the thumb is going to respond. Okay, so it's a small reflex. Now, when you go all the way up to the arm here, you see, when you go up to the arm here, the whole arm's going to reflex. So what I like to do is I like to lower the intensity a little bit. I don't want to hurt the patient. Okay, now I'm going to start stimulating. Let's see, 10, boom, 12, 17. So basically 17. Let's go up 18. See, it's not going to change. So pretty much the same thing. Usually, sometimes when you get to the arm, the upper arms, you need a little bit more intensity. Let's save that. Let's go to my axilla. I haven't done this in a while here. There you go. Boom. Right above my axilla, right above my my armpits. Right? I stimulate it. So basically, 17. Now, let me go up a little higher here. Let's go to 20. Let's go to 25. Let's go to 29. That hurts. It starts to hurt a little bit. Let's put more gel, because if you don't have gel, then it starts to hurt. I'm gonna see how much I can take. I haven't done this in a while. 33. Yeah, 33 starts to hurt. You know. So basically, someone like myself, 5'9", 175 pounds. If I go more than 30 milliamps, it's gonna start to sting. So basically, you're talking about in the stimulation process using milliamps, pulse width of 100. With the intensity in the teens, that's what I need for my nerves to react. Some patients might need more, but let's just say that anyone with good medical condition, with no medical conditions, someone healthy, someone younger. I mean, I'm 50 years old. Nerves start to deteriorate at the age of 60, but someone in their 20s, someone who weighs less than me is going to need a little bit less, but still. So today I had a young girl. She was about 23 years old. Okay, and I use a little bit less intensity in myself. See, I had the pulse width at 100, and usually I have it at 200, but with her I used it at 100 because I wanted to see something for this video. And then I was using the intensity. I think I went as high as 11. So with me, I might need a little bit more, 7 milliseconds, but it doesn't really matter how high you go. What matters is that you're going to use the exact amount of intensity that patient needs. So you got to be able to gauge it. If you use too much, then that's going to be a problem. So now usually what I do, okay, I don't use the intensity at pulse width at 100. I usually use it at 200. Okay, so let's see how I respond with a pulse width at 200. So now I don't have to use that much intensity. Okay, and the reason for that is because the higher your pulse width, the less intensity you're going to use, and then you're going to have more pulses on that intensity. I like to use, and then for the lowers, I like to use the intensity the pulse width at 300. That way, I don't have to be playing with the intensity too much. Okay, so let's go. So now before I responded at I think 15, 16. Okay, so now let's do this. Okay, so now I'm responding at 10. Let's see. 11 is not going to change. 13 is not going to change. 17 is starting to hurt a little bit. I don't like the way that feels. I mean, 17 with a pulse width at 100 is okay. 17 with a pulse width at 200, it's a little strong. It's a little strong. Let me do something here so you guys can see for yourself. So I'm going to put the pulse width at 400 now. Okay. Now I'm going to come back here. Now we know. Wait, I had the pulse width at 200 and I responded at about 10, right? Now let's see here. Boom, 6. So I don't need more than 6. I don't need more than 8. See that? It's not going to change. So basically 6. Now let's do one more thing. Let's put the pulse width as high as you can go. Okay? So you still have to control the intensity no matter how the pulse width is. Now I'm probably going to respond like at 3. Okay? Let's see. There you go. 4. See? So the higher the pulse width, the less intensity you're going to use. Now obviously if I go to 17 on this, 9, it's starting to hurt now. You know? So, in fact, I should increase the pulse width a little bit more because then I don't have to use that much intensity and I could use my nerve examinations a little a little faster instead of having to increase. But you have to be really careful. You can't be trigger happy. If you have the pulse width, the higher you have the pulse width, the better you need to control the intensity. But a suggested pulse width when you do an upper extremities test, it's 200. That's what I like to use. And the lower extremities, people have a little bit more tissue, more mass, so you're going to increase in pulse width. I like to use anywhere between 300 to 500. But the intensity is what controls it. The intensity, you have to use the exact amount of intensity that patient needs for the nerves to react. Let's do a quick sensory nerve really quick. Let me just switch here. And then we'll do that. I messed up on this tape here. And normally, I'll be honest with you, nerve examinations do not hurt. If you know what you're doing, if you know what you're supposed to do, if you control the intensity, you're not going to have a problem. The problem is that most technicians and doctors, they have poor communication when it comes to these studies, and they do not know how to gauge the intensity. They use too much intensity. They start high. You have to start at 0, increase, and then use what that patient needs. Okay, so let me give you guys a quick sensory nerve here. So I have the pulse width here. I have the pulse width at 500 for the sensory nerve. Okay, look, so I'm going to, I haven't seen my nerve in a while. It looks pretty good. Look at that. So I don't need no more. Look, 9 is starting to sting a little bit, but I could take it, of course. 7, I could still go lower. Why is the, okay, yeah, so then my gain was a little low. Well, was a little high actually. So basically, for my sensory nerves, okay, I haven't done this in a while on myself. For my sensory nerves, there you go. For my sensory nerves, I basically need, let's see, label this correctly here. I'm holding my mouse with my middle finger, so it's uncomfortable. So I basically need, with a pulse width at 500, 7. Let me take the pulse width to 200, which that's the average. Let me save this here. All right, so let's go to 10, let's go to 11, 10, 13. So that's basically what I would need for these nerves to react. Let me just change screens and clean the screen, okay? So let's see here, one more time. 8. Okay, good. And I'm going slow, okay? So it's basically 16 with a pulse width at 100, and that's basically high, okay? I don't need to go up to 16. I'm just looking at my threshold here. Okay, sorry, I didn't mean to interrupt the video, but one of the things that I forgot to mention is that when it comes to the pulse width, the highest you can use that pulse width is 1,000. I know I said let's just go as high as you can. So the pulse width traditionally I think it can start at 50. I'm pretty sure it does, but nobody uses 50 because that is too low. Okay, normally it starts at 100, but I think 100 it's really too low because then you're gonna have to use more intensity, like I mentioned in the video. So it goes from 100 to 1,000. The higher the pulse width, then obviously, the less intensity you're going to need, and which it kind of works out because sometimes you find yourself going up, increasing until the patient feels like. The only thing is that if you have a high pulse width, you have to be really careful that you don't crank it up too high and too fast because then you're going to end up hurting the patient. You have to just kind of be alert at those settings. But if you know how to use the pulse width correctly, and if you know how to use the intensity correctly, if you know how to communicate the test to the patient correctly, you shouldn't have a problem. And I know there's a lot of technicians that maybe breeze by this test, but there's some that don't, and there's a lot of patients maybe who end up getting hurt sometimes, and they walk out of there feeling pain. And the purpose of this video is to educate these patients so they can go into these facilities now knowing exactly what's going to happen. And if the technician starts with the intensity high, the objective is to tell them, do not start high. You start at 0, increase, and then use what my body structure tells you what you need, how high you need to go. And that's about it. But anyway, with that being said, we're going to make more videos. Remember, this channel is not just about EMGs or electrodiagnostic medicine components. I mean, that's where we are starting, but we're going to speak about many healthcare topics. It's really important that we individuals keep ourselves healthy and also use preventive measures and not wait until we get sick. Okay, so we're going to speak about different types of technologies to make sure that you guys, that we stay healthy. And I'm 52 years old, and I try to take care of myself, and that's what I want to translate to you. Things that I've been doing for the last 10 years, especially for the last 5 years. Because when you hit your 40s, you still feel young. It's after 45 that the body starts to feel a little bit different. So I've learned, I learned to take care of myself in different ways, because, when we get older, then the body structure changes. But if we do certain things with our lives, then we could be young for a very long time. So it's about eating healthy and just taking care of our bodies. We're going to also speak about, in this channel, about high blood pressure. It's definitely millions and millions of individuals suffer from high blood pressure, and then sometimes they don't know the reasons why. And no matter what happens to us, whether we suffer from anxiety or high blood pressure, there's always a reason. We're going to be speaking about that. And one last thing that we're also going to speak about is sleeping. Now, millions of Americans suffer from sleeping disorders, and much too often it goes undiagnosed. And there's something out there called sleep apnea, which, like I said, it goes undiagnosed. So we're going to speak about that and how sleep apnea compromises the cardiovascular system. It can give you high blood pressure. It can give you type 2 diabetes. Okay? And if you have diabetes, then it causes what? Neuropathy, which nerve disease. So we're going to speak about these type of sleeping disorders, how often it goes undiagnosed, and sometimes you can go to your doctor, your primary care physician, who's fully educated when it comes to medicine, and all he's going to do is just give you medication and not get to the root cause of what's going on with you. So we're going to speak about a lot of those health topics. And if you like this video, please press a like, subscribe. That way you know when I take out my next video. We're going to try to make it a goal with this channel to take out at least one video per week. We've been a little slow. I mean, the truth of the matter is, with a family, I'm always working. It's kind of difficult to take out videos at a consistent basis, but at this point, I really don't have a choice. If you want to grow the channel, digitize the business, or digitize at least the way I work, then these things have to be done in practice. And there's a great need out there, and I want to reach out as many people as possible when it comes to EMGs and healthcare. Anyway, with that being said, I'll see you in the next video. Bye-bye.